Thank you everyone for the opportunity to present some of our work. Here I'll be talking about the use of a deferoxamine intradermal delivery patch for the treatment of a beta thalassemia wound. As a brief background, deferoxamine is an iron chelator that has been used many years systemically for the treatment of iron overload and iron overload diseases. More recently, we have been interested in topical deferoxamine use in the context of cutaneous diseases from radiation-induced fibrosis to diabetic wounds and even sickle cell-related wounds. The mechanism of action is thought to be from the direct iron chelation, but may also be HIF-1 alpha activation, neovascularization, and improvement in collagen deposition. Deferoxamine has yet to be reported for use for beta thalassemia wounds in humans or in preclinical models. So this will be the first in-human use of this medication. Given the promising preclinical data and approved ongoing clinical trial using deferoxamine on sickle cell wounds, we elected to use DFO in a patient that was suffering from a beta thalassemia wound for 55 weeks. Ultimately, her wound healed after 21 weeks of treatment. In brief, the patient was a 41-year-old female with beta thalassemia who was getting every month and every other month blood transfusions to help heal this right medial ankle wound that she had had since April of 2020. The wound had partially healed and recurred many times. She was treated in our advanced wound care center, and we had exhausted all of the alternative therapies. We then decided to move forward with treatment with this investigational drug. Throughout the treatment, we measured the wound size with a 3D imaging system and drew serum levels to ensure that the serum level of deferoxamine was not dangerous. If you look at the photographs here, you can see some representative images of the wound over the course of treatment onto healing. On the graph, we followed the patient formally with a 3D imaging system for several months before initiating therapy. You can see that during that time, there was no change in wound size. The green lines note when the drug was started. We did have to stop use of the drug due to a skin reaction for 2 weeks, but that was restarted after she improved. She then progressively healed the wound to completion. The only other interruption in treatment was to extend the FDA approval for treatment, which is that 1 week in February. In conclusion, we think that topical deferoxamine is a very promising therapy for treatment of beta thalassemia wounds. Additionally, there is also work showing that use of this topical medication in radiation-induced fibrosis, diabetic wounds, and sickle cell-related wounds is very promising. Moving forward, the next step is to further elucidate the efficacy and safety of deferoxamine in sickle cell disease and beta thalassemia in the context of a clinical trial. Thank you.